Okay.
Welcome back to the morning show. Dr. Christina is here with the All Wellness Medical Center. Something new.
I know.
Good
I am
morning.
so excited.
That's awesome. Tell us
I
what's going
know.
on.
Well, April 1st, we started the All Wellness Medical Center. And a lot of people are asking, well, what is that all about? Are you not doing medicine anymore? Of course I am. I'm doing traditional, conventional medicine,
Right.
which is gynecology, as well as primary care for
Right.
both men and women. But now there's a little twist because of the fact that this is a trend in medicine that has been really out there, but not in the tri-state area.
Okay.
So, because of the fact that also an integrative medicine fellow, this means learning about prevention.
Okay.
We are 37th in the United States for prevention, which is horrible when you compare it to the rest of the world.
Obviously.
We're number one for acute, which is great for us when we have heart attacks and strokes. But the whole idea is, how do you learn how to prevent getting from point A to point B? And in medical school, we're always taught disease oriented.
Okay.
So now we've changed. We've now looking at how can we prevent the disease, listening to our patients, partnershiping with our patients, and actually treating the body, not only the body, but also mind and spirit. If we do not include the entire entity of that person, we'll never be able to take care of them.
Well, that sounds like a big tide to wade through.
Yes, it is, but we're looking and seeing that even across the country, it's just not here. Across the country, Harvard, Yale, residency programs from all over the place are finding that traditional medicine is failing. All we're doing is giving handouts as far as pills, surgery, and that's it. We don't have time for anything else. Well, that trend has to stop because we're failing. We're not picking up diseases until almost at the last phase.
I see. Okay, now I see where you're going with this.
Yeah, especially like cancers and whatever else.
Right.
So if we can teach people nutrition, exercise, what else is out there to de-stress themselves, okay?
Yeah.
So if we start looking at that, teaching how do they eat, what is their problem, listening to the patient knows more about themselves than we give them credit for. And as doctors, not being arrogant or anything else, but please get together with that patient, form that partnership, learn about them, and then can we give them ideas as to how they can have more productive life?
All right.
Longevity.
I know that stress is a component of heart disease.
Right,
Huge component.
right.
Also know that smoking,
Correct,
diet,
correct,
we know all those things are connected.
correct.
What about the cancers?
The same thing. Cancers are caused by anti-inflammatory. It's really caused by inflammation, just like a heart attack, stroke is. Our immune response goes down. So if we can figure out a way by diet, if we can figure out a way by exercise, de-stressing yourself, once you get so stressed out, you're not able to contain your immune response. And so when that immune response goes down, voila, here you go, get a cold, get the flu, but worst of all, get cancer. So if we can go ahead, like for example, May 2nd, we're going to start a yoga class.
Okay.
And we're going to do
I
it
love
after
yoga.
hours.
Yeah.
Okay, why? To try to de-stress people. But we're also going to do it on Saturdays for people who actually
Awesome.
work Monday through Friday. Why are we doing that? It's not only for people who are not used to exercising, but do it mildly. But the other thing is also to get their mind stop that mind chatter. Stop all that thing
Right.
that is going in their head that prevents them from really
Excuse me.
actually taking care of themselves. We're going to be doing Tai Chi. We're going to be doing traditional Chinese acupuncture, which
Oh,
is
really?
quite different from any other type of acupuncture you've ever seen.
Yeah?
We're even talking about getting a masseuse in there. Why?
Wow.
To help people to incorporate that partnership with both of us and open that communication. For example, that you can look at my eyes, I can look at your eyes. We're going to come up together with a plan. And that is the whole idea of all wellness. In other words, usually 5 minutes, you're with your doctor, bye, that's it, script in your
Right,
hand,
right.
and that's it. And where's your question? We can't answer all the questions in one visit, but the whole idea is starting that plan of action so that you take responsibility when you're at home. I mean, where you can take care of yourself. Let me teach you how to take care of yourself.
Kind of sounds like, just from a layman's point of view, it kind of sounds like you're attacking every level of health.
Exactly. Well,
Right?
there's no other way that we can do it because obviously, if we're 37th in the world,
Yeah.
that's pretty
Yeah.
bad.
Yeah.
Okay, and so
So are these, and not to interrupt, but I'm interrupting. So you're telling these other places that are less than 37th, are they practicing some of the
Yes.
things? Oh, okay.
absolutely,
right.
absolutely.
So this isn't just your idea last night.
No,
No.
this trend has been happening around the world.
Really?
United States is a little slow. However, when would you think it would be here in the tri-state area? When would you think that it would be in Bullhead City and they can treat
2030.
Yeah, honest to God. That is almost impossible. But I just happened to have practiced here for 15 years.
Right.
And then I saw that trend. And also I saw that it's not working. We have to do something for our people. So then I decided to go do a fellowship and then become part of Dr. Oz's Share Care team, as well as Dr. Andy Weil. A lot of people know who they are. They've written many, many books. He's my mentor. And the whole idea is, how can we bring it to you, the audience, and to be able to work with you and to be able to see if we can make a difference in your life where we can cut down on the types of medicine that you're taking. For example, by good diet, cholesterol medicine,
Right.
high blood pressure, de-stressing you.
Right.
What are some of the other things? Sure, some of you are still going to have to be on medicine. I'm not anti-medicine. I give it. But is there other ways that we can do to help each and every one of us?
Right.
Not just the baby boomers, but even your children. Look at the obesity. Look at everything that's out there, diabetes, all of that. There's got to be a way that we can make a difference. So all wellness is something that has been in my mind for such a long time. And it's just the right opportunity to come out and do this center.
There you have it, ladies and gentlemen. All Wellness Medical Center. Same place on the Parkway, just so much more. And, you know, when you talk, and I know we're almost out of time, when you start talking about acupuncture, which I dearly love, you start talking about yoga, which used to do yoga all the time, Lynn and I, with some friends who were, she was an instructor, so we did that. My biggest problem with yoga, though, I've got a problem with it.
What is that?
Well, at the very end, I do fall asleep on the pad, and then I start snoring.
That's okay.
Yeah,
That's
and
okay. We're even going to provide pads
Oh, yeah?
and blocks.
That sounds
Yes,
great.
absolutely.
When's all this starting?
May the 2nd is when our first class is.
That's right around the corner.
Yes, it is. We're going to start putting these things slowly but surely
Wow.
so that the people can understand what this is all about.
Okay.
And that it's just not like just one big conglomeration of one thing,
Right.
but it's about education of what this is for. Like when I come back and we start talking about the different other entities,
Okay.
then I'll explain what each one is for and let you know how it's all riding out.
I'm looking forward to it.
Thank you.
Thank you for being here.
Absolutely, my
Dr.
honor.
Christina. All Wellness Medical Center, ladies and gentlemen. There's a phone number. It'll be there in a second because Sam's really good with that. There it is. Thank you, Sam. 704-4499. Call, make an appointment, or find out more about some of the special things that are going to be going on because it is for your health. And what she says makes sense. It really does. We all need to distress just a little bit. De-stress. Not distress. De-stress. We'll be back with more of the morning show right after this. I guess my de-stress would be to quit distress.